So hi, I am CEPHALOSPORINS first generation. So my generic names are cefadroxyl, cefazolin, and cefalexin. So my brand names are generic, Jolicef, and Keflex. So my chemical names is my drug classification for therapeutics is very effective against gram-positive bacteria. So my pharmacologic is antibiotic. So my pregnancy category is categorized for B. So there are no known effects of this drug on growth on pregnancy. If pregnant and taking a cephalosporin antibiotic, ask obstetrician or the prescribing physician about possible pregnancy complications or birth effects. So the drug group is generally considered safe for use during pregnancy, but each drug is slightly different and may have different side effects.
Cephalosporins' mechanism of action. Bacteria synthesize a cell wall that is strengthened by a cross-linking peptidoglycan units via penicillin-binding proteins, initially derived from the fungus Cephalosporium species. Cephalosporins are a large group of bactericidal antimicrobials that work via their beta-lactam rings. The beta-lactam rings bind to the penicillin-binding protein and inhibit its normal activity. Unable to synthesize a cell wall, the bacteria die.
So my pharmacokinetics. For absorption, most cephalosporins can only be administered parentally. Among agents that are absorbed from the gastrointestinal tract, those with bioavailabilities of 85 to 90%. My distribution. Cephalosporins are distributed in most body fluids and tissues such as the kidneys, lungs, joints, bone, and biliary tract. However, with the exemption of some third-generation cephalosporin, these drugs poorly penetrate the CSF. So my excretion is eliminated rapidly with serum half-lives of 1 to 2 hours. So cephalosporins are eliminated mostly by the kidneys, some with a substantial contribution from active tubular secretions, which is blocked by probimine-acidin. The degree of metabolism varies only a few cephalosporins have a high biliary elimination. So my indications is that I indicated effective against the same gram-positive bacteria affected by penicillin G as well as gram-negative bacteria for P. mirabilis or K. phenomena E. coli. So my contraindications is known allergy to cephalosporins and beta-lactams. Cross reactions are common. And hepatic or renal impairment. These drugs are toxic to the kidneys and could interfere with the metabolism and excretion of the drugs. The next is for pregnancy and lactation. Potential effects on the fetus and infants are known. So use only if benefits outweigh the potential risk of toxicity to the fetus or infant. Then last is reserve cephalosporin for appropriate situations because cephalosporin resistance bacteria are apparent. So my side and adverse effect per body system. So for central and nervous system is I will give you headaches, dizziness, lethargy, and paresthesia. So for gastrointestinal system, I will give you nausea, vomiting, diarrhea, anorexia, abdominal pain, flatulence, and pseudomembranous colitis. And for others, I will give you transient liver problems, nephrosity in patients who have predisposing renal insufficiency, superinfections, and phlebitis and local abscess at the size of IM injection or IV administration.